It's time for our daily dose of Cope. And we have Alona Leopard at the news anchor's desk for the Leopards News Network. And here she is with her snazzy hat. We're going to start with the state of Idaho. Idaho overwhelmingly went for Donald Trump. Because of the fall of Roe, Idaho had trigger laws that went extra strict where it came to termination rights for women. And so back in August 2023, I put out a video and I was talking about Idaho has run off all of the OBGYNs. And obviously that was going to have an impact. Fast forward to right now, because voting has consequences, Idaho banned terminations. 3 years later, minors and seniors struggle to get routine care because they ran off the medical professionals. They are seeing the consequences of their action, and sometimes those consequences come a little bit slower. So I am going to sit here and do this entire article. We are going to talk about the fallout because we are going to continue to see fallout from many of these policies, and it's not just the fall of Roe v. Wade. We're going to see the exact same thing happen with the fall of Medicare, with the fall with SNAP being stripped. Sometimes you don't see things immediately, but you will start to see the fallout. And trust me, I can find my articles where I have talked about these things before, because we are going to, like, people are like cheering, like, yay, we're stripping Medicaid. This is going to cause all of these Republican policies are going to cause a lot of unnecessary deaths. And I'm not saying that this is causing deaths right here. I'm just talking about consequences of policies. Of all the outcomes Rachel Castor could have predicted from Idaho's termination ban, her teenage son being denied hospital admission during an asthma attack wasn't on the list. Bonner General Hospital in Sandpoint announced its decision to end obstetric services in March 2023, roughly 6 months after the near-total ban took effect. Among the stated reasons were the state's legal and political climates concerning healthcare and the loss of pediatrician staffing. They ran off the medical staff. Castor saw the fallout from that decision on a night in early April. Her 17-year-old son spent several hours in the Bonner General emergency room before the staff informed her if his breathing didn't improve enough for discharge by the morning, he would need to be transferred an hour south to the hospital in Coeur d'Alene. Bonner General Hospital had no pediatricians. And I was like, excuse me? Elaine Glockel, a 66-year-old Boise resident, said she started having trouble with her urinary tract infections and hormonal balances recently and found it hard to get an appointment to see a specialist, even with a referral. It was even more difficult to see a doctor for gynecological care. That wasn't always the case in the more than 30 years she's lived in that area. She used to have no trouble seeing doctors. But now for gynecology visits, along with care for diabetes management and kidney issues, she has seen physician's assistants who are supervised by the doctors within the practice. While she has had good experiences with the assistants, it's sometimes difficult to feel confident in their assessments when she isn't sure how much they are consulting with the doctors. And the wait times are still long, at least 6 weeks, usually in her experience. I have no idea who the doctors are. I've never met them, Glockel said. And I don't know if that means anything or if it's just a peace of mind that there is a doctor in the mix. It's been 3 years since the U.S. Supreme Court issued the Dobbs ruling that ended federal termination protections and allowed more than a dozen states to implement termination bans. States that were already struggling with physician shortages say they're getting worse, especially in rural areas where many labor and delivery units have also closed their doors. Clinics have also closed and resources become more strained with every passing year. Patients and providers have been left to adjust to barriers accessing termination care, legal battles that continually redraw access lines, and heartbreak and tragedy as women die from easily treatable conditions like miscarriage and infection. In places like Florida, Kansas, and Louisiana, patients have had to find other providers who will help them with miscarriage complications, often requiring them to travel to a neighboring state with legal access because doctors in states with bans are afraid to see them. Other patients experiencing miscarriage or the threat of miscarriage have reported waiting hours in emergency rooms to be seen, while hospital staff consult with attorneys about their legal exposure before taking any action. A Florida Republican lawmaker who is a forced birther said recently that she waited hours to receive treatment for an ectopic pregnancy, which is dangerous and non-viable. She went on to blame Democrats, even though it was Republicans that were forced birthers that ran off medical staff or made medical staff fear fines and jail time. Besides Texas, few states that implemented termination bans after Dobbs have been as much of a spectacle as Idaho. Between a so-called termination trafficking law that first passed in Idaho, the very public loss of many OBGYNs and maternal fetal medicine specialists, and a legal fight with the federal government over whether terminations should be permitted in emergencies, a lawsuit that made its way to the Supreme Court, the state has been a testing ground of sorts for how a near total ban can play out for communities. Many healthcare providers and advocates warned it wouldn't just be termination care or even pregnancy-related care that would be affected by the Dobbs decision. Dr. Stacy Sieb, a maternal fetal medicine specialist in Boise, said in July 2023 that the near total ban would lead to more consequences as time went on. It feels like a step backwards in improving the health of women and children in the state, he told the Guardian. Soon, he warned, the state will see a collapse in women's health care. It makes me wonder what else we've lost that we don't know about. Bonner General Hospital's obstetric unit was one of many rural hospitals that was already struggling before Dobbs with changing community demographics that meant lower birth rates and difficulty recruiting and retaining physicians. Among its population of about 10,000, the hospital admitted fewer than 10 pediatric patients in 2022 and delivered 265 babies, a decrease from prior years. It's a familiar situation nationwide. More than 100 hospitals across 26 states have closed labor and delivery services since 2020. 100, y'all. To be sure, the reasons for those closures include many factors than termination bans, such as low reimbursement rates from Medicaid programs for obstetrician services and difficulty recruiting and retaining physicians. In its announcement, Bonner General representatives said they tried to recruit active and retired pediatrics providers in the area, but no long-term sustainable solutions were available. Nobody wants to go to these rural states if they have any sense. And young women are choosing to do residencies in places that are not these strict bans these strict states. They want to go places where there are actually places that respect women's reproductive rights. So they're going to continue to see these declines. People are going to keep saying, no, I don't want to go to your state. At that time, it didn't sink in for Castor that having no pediatrician coverage at the hospital would mean no admission to the hospital for minor children. Sandy Brower, Director of Quality and Risk Management at Bonner General Health, told State's newsroom via email that their staff is well equipped to see pediatrics patients who are always seen, treated, and stabilized in the emergency department. But she admitted that the hospital does not admit minors because they have no pediatricians on staff. This approach is not unusual in rural healthcare, Brower said. Around the country, critical access hospitals often rely on stabilization and transfer protocols to ensure that patients are seen in the most appropriate setting. Faced with the prospect of driving her son to Coeur d'Alene herself or guessing what a 44-mile ambulance ride might cost, Castor, a single mom of two and a teacher, decided to drive to the hospital she'd never been to before. But with little information to go on about the transfer process, she was left wandering around the hospital looking for the right place to go while her son's condition deteriorated. The inhaler used by Rachel Castor's 17-year-old son, who has severe asthma that prompted an emergency room visit in April. That's not a complete sentence, but okay, let's move on. He had to be transferred to Kootenai Health an hour south of Coeur d'Alene, Idaho, because the local hospital, did not have pediatricians on staff. Imagine how this could be. This could really play out terribly, where people literally die. This child sounds like he lived, but this could really prove to be fatal if people are having an emergency right now. So it looks like the Idaho population is at 2 million, but it's had 4 hospital closings. So I really wonder what their kind of care that they're going to have at these hospitals. We talked about Idaho for a considerable time. Let's talk just a little bit more about a few more faces being eaten. So we got Chi-Chi Kachiyama again, and the face is saying, I voted for you. Why is ICE taking my family or my friends, one or the other? Why is that? Oh, because you voted in a racist person that basically is going after these people because he said bloody mass deportations. That's why. We have Twaz Allah. She says, what is going on in the United States is insane, especially Florida. I am a registered Republican in the state of Florida. I voted for Trump 3 times. I voted for DeSantis 2 times. I voted for undocumented, illegal, criminal border jumpers to be deported, not to deport legal, tax-paying, hardworking immigrants on a path to citizenship. Lee was unlawfully detained 6/12/2025 and is being held at Crome Detention Center in Miami. The amount of mental and physical abuse he has suffered is insane. We are working diligently to get him released. I am completely disgusted by the actions of many ICE officers. They are just as out of control as the IRS. I will never be a Democrat or a liberal, but it pains me to say they are right on this issue. Right now in Florida, the only thing important for our governor is to get his numbers on detaining as many people as he can, regardless of legal status. Yes, that is literally it. They do not care. They want to detain brown people. And Trump is already denaturalizing people. He is stripping people's protected status, which now makes them undocumented. So people like Twaz Allah is going to miss out on people. They're going to just snatch people up. They have these ICE agents jumping out of cars. They are not identifying themselves, and they are literally snatching people. That is where we are in the United States. We literally have people snatching folks off the street, going to people's homes with pew-pews, making them just go with them. This is where we are in the United States, and people like Twaz Allah and other people voted for this. I hope that they lose all sleep at night. I hope that they feel completely terrible about what they did. She's sitting up here saying, I will never be a Democrat or a liberal, but we were right. Well, yes, we were right. So what are you going to do to fix it other than making a Facebook post? Got a little passionate there. My bad. She is upset. This is still Twaz Allah. She says, horse cocky. If Carlos doesn't think they cleaned up that place before he went in there, then he is too dumb to be our congressman. My friend Lee Stinton has been detained there since June 12, 2025. Lee Stinton was not allowed to take a shower or get new clean clothes for 5 days. Lee Stinton has been sleeping on the floor up until yesterday, June 23, 2025. Lee Stinton just received his PIN number and processed yesterday, June 23rd, to make calls. Lee Stinton has no criminal record and is legal to be in the United States. So now that it's her friend, now that it's impacting her life, now she wants to talk about this stuff. But this is how these people are being treated. She's talking about it, but what about the people that don't have a voice? This person named Hysteria made a post. She says, Tasha supports Trump because she wants the party to clean up the U.S. and get rid of the immigrants. She's going to lose her food stamps and will have to start buying groceries with her savings. Let's look at this post that Hysteria posted. You can see that this is a friends only post on Facebook. So Tasha says, this is literally $401 worth of Winn-Dixie groceries, and I still have $135 left on the SNAP card. Trying to stock up because after this month, me and my family of 4 won't be having SNAP benefits due to this big, beautiful bill law that passed. It's sad, really, because I got a 13-year-old and a 16-month-old, and I thought food stamps was for children 18 and younger, but I guess I was wrong. So now I have to dip into my savings to feed my kids. And by the way, you can still buy junk food. I heard something about they're going to stop letting people buy junk food on SNAP. So she's being impacted. And that's the thing. Many of these people forget that they are actually getting benefits. These people vote for the party that snatches benefits, that don't give a damn about children. They have said they've been snatching free lunches from kids for the longest, but this is what they voted for despite being a poor. She's a poor. Many of the people living in these red states are poor MAGA. So the fact that they keep on voting for MAGA to make sure that their benefits get stripped so that the billionaires and the decamillionaires can have more money, they are the opposite of smart. Let's do some of these comments. So this person says, I don't even get SNAP and groceries are so expensive. I spend over a G or more on food. I agree. I am so tired of having to eat and buy groceries and buy toilet paper. I am so over it all. And here's Tasha saying, it's sad. And they're going to cut people's Medicaid off too. Both of my kids are on Medicaid also. So it's going to be a struggle to afford food and medical. Ooh. The fact that these people voted for this, they voted to strip their own food and healthcare away. I wonder how dumb they feel. Oh well. So here's the woman that posted it. She says, me. Didn't you vote for Trump? This is what happens when you vote in an administration that is only thinking about making the rich richer. And here's another picture of Tasha. It says hashtag Let's Make America Great Again and hashtag Donald Trump 2025. Here she is holding a mug that has Donald Trump and thumbs up. There you go. So this is definitely a Trump supporter. I really only like to make these FAFOs if I know that people are Trump supporters. Okay, so this person, JWTS6, says, you got to update us with her response later. I wonder whom she's going to blame for no longer being able to afford food because of her dear leader. And here's the OP coming through with another screenshot. So here's Tasha saying, nah, I haven't voted since I was 18, and that's when Obama was running. And here's the OP saying, but you support him. I've seen your post. And she says, yeah, I am a registered Republican, but I know nothing about politics or religion. Ew. And then here's the woman saying, you should really educate yourself on politics. Religion shouldn't have anything to do with the government. Being ignorant on who is running or supporting a candidate without research hurts not only yourself, but others as well. And that's the thing. She's saying that she didn't vote for him. Okay, whatever. That's probably a lie. But the thing is, even if we hold her to that, even though she has this picture that says, let's make America great again and Donald Trump 2025, let's say that she's not into politics. Politics will do you. You might say you don't do politics, but politics and policy will do you. If you vote in the party that is going to strip your Medicaid and strip your SNAP, you should want to do politics because now you get to live with the consequences even though you didn't exercise your right to vote. So you still get what you get. But even if she had voted, she would have voted for Donald Trump. So this woman is getting exactly what she deserves. Spooky Spaghetti says she knows nothing about politics, but makes posts about Trump. Winter's Child says, I don't vote. I don't know anything about how the world works, but I encourage others to vote for a guy who wants to starve my kids just because. LOL. The state of education in this country makes me want to cry. Seahawk says, I bet they did vote for Trump, but are afraid to admit it. Boko says there aren't a lot of people out there who spend money on Trump merch. Exactly. And then turn around and not vote for him. That's the reason why I say that this woman is lying. But you go ahead and join the conversation. Let me know what you think. That's all that I have today. I did that whole other video with all of Idaho. There will definitely be more tomorrow because there seems to be a lot of FAFO daily. Let me know what you think. Like, comment, and share.
A lot of you ask me what FDT means, so I made a song for you. F is for fuck. D's for Donald, T's for Trump. Sing it with me. Fuck Donald Trump. F is for fuck.